Before entering the room, I must first check if the scene is safe, that there are no wires or spillages that may cause any slips, trips, or falls. So I can see that there are none. The scene is safe. I'm happy to proceed and see the patient. Good morning.
Good morning.
Hello, my name is Aya. I'm one of the nurses that you have for this morning. The doctors have advised for us to collect a CSU or a catheter sample of your urine if you agree to doing that.
Yes, it's okay.
Right, so they have advised for me obviously to collect that, but first I must check if I am with the correct patient. So if you will allow me to check your wristband.
Yes, you can.
Right, okay. Can you tell us your name and date of birth, please?
Lindsay Lujan, 1/1/1988.
Right, so MRN number is 1234567X. I can confirm that I am with the correct patient, and the CSU is meant for the correct patient as well. So I can see you've got a catheter there, Lindsay. So I was saying earlier, we're gonna collect a sample of your urine. So this will entail us to collect your urine sample via a syringe through your catheter tubing. You shouldn't feel any pain or discomfort, but if you may feel any of these, you can let us know so that we can stop the procedure immediately. Does that sound good to you?
Yes.
Okay. I forgot as well. Do you have any allergies, Lindsay, to any like drugs or latex?
None that I know of.
Perfect. So I should be happy to proceed gathering the materials. I'm going to collect them first and leave you your call bell. If you need anything, please don't hesitate to give us a buzz, okay?
Okay, thank you.
I'm going to give you your call bell and I'll see you in a bit. Before proceeding to go to the patient's bedside to collect a CSU or a catheter sample of urine, I must first prepare my materials that I need. Before doing so, I will do my hand hygiene and don my PPE. Okay. Right, I will need to prepare a tray, which I will need to check with the examiner if it is disposable or reusable.
It's disposable.
Right, so it's disposable and I can see that it's visibly clean and dry, so I'm happy to use that. Along with this, we will need an underpad to place underneath the catheter. We will need a specimen bottle, intact, dry, and within date, so it expires 2024. I'm happy to use that. There are no discolorations whatsoever. We will need a non-traumatic clamp, a 10 ml syringe in a packaging that is clean, dry, and intact. There are no discolorations that are noted inside the packaging and within the equipment, and it was within date 2026. I'm happy to use that. And will need 2 Clinell wipes. Packaging is intact, clean, and dry. No discoloration, and they are both within date 2024. I'm happy to use them. So I've got all the equipment I need. I'm going to approach the patient at the bedside. Hello, good morning, Lindsay. I'm back.
Good morning.
I've got my equipment with me. First, I need to do a couple of things. One is I'm gonna ask permission if I can move things around in your room so that everything will be accessible. And two, I'd like to check your identity again against your wristband, if that's okay.
That's okay.
Right? Can you tell me your name and date of birth?
Lindsay Lujan, 1/1/88.
Right? MRN number is 1234567X. I'm happy that this is Lindsay Lohan and I'm going to perform the CSU at your bedside. Right, Lindsay, so I can confirm that I'm with the correct patient. Do you have any allergies that you are aware of?
None that I know of.
Perfect. So I'm going to proceed. I'm just gonna put this aside and see, I can see that you've got your catheter there. There is some urine in the tubing, so I'm happy to not manipulate that. But if there wasn't any, I would first need to manipulate it gently because sometimes there can be kinks in the tubing that might disrupt the flow of urine. So you don't have that. I'm just gonna straighten this. Right, lovely. And then I'm gonna discard my gloves and do hand hygiene and put new non-sterile gloves on, okay?
Okay.
Right. You feeling okay?
I'm okay, thank you.
Good. Like I mentioned earlier, this shouldn't hurt or you shouldn't feel any pain or discomfort. It will just be a brief procedure. Okay? Right, so I will need to use an underpad just so we don't soil the bed. There we go. Just gonna manipulate that a little bit. Right? And because I've touched that, I'm gonna change my gloves again. Do hand hygiene. So I'm gonna first clean the tubing, Lindsay, before we collect any urine sample. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 29, 30. I'm gonna put the clamp in distal to the sampling port. Right, that's set. And because this is a needleless system, I'm just going to put the syringe directly into the middle of the sampling port, okay? So you shouldn't feel any pain, right? So I have withdrawn an appropriate amount, which is 10 mils. Did you feel any pain at all during the procedure?
Not at all.
That's good. So I'm going to immediately put it in the specimen bottle that I have here. So that is 10 mils going straight into the specimen bottle. And I will immediately discard the syringe and close that tightly, right? So now that that's done, I will use my other Flanell wipe so I can clean the sampling port again. 1, 2, 3, 4, 5, 6, 7, 8, 29, 30. Right? I have removed the clamp now, Lindsay. Does that feel okay?
Yes.
Perfect. Right, so I'm gonna get this out of the way and dispose of my equipment correctly, as well as send the sample into the laboratory. Do you need anything else, my dear?
No, I'm okay.
Perfect. So I'm just gonna discard my gloves and gel my hands so I can give you your call bell. Here you go. Please don't hesitate to give us a buzz, okay?
Okay, thank you.
Perfect. So after collecting the catheter specimen of urine at the bedside and after placing it in the specimen container, we must first ensure that it is tightly sealed and properly labeled and sent right away to laboratory after it's been obtained. Okay? So for disposal of our materials that we used, underpad and the used Clinell wipes go in the clinical waste bin. If the non-traumatic clamp is also disposable, this will also go in the clinical waste bin. Because I've already discarded my 10 ml syringe earlier in the clinical waste bin as well. All the wrappers will go in the regular bin. And because our tray is disposable, I will also put this in the clinical waste bin. Once that is done, I will discard my PPE. Right, so after we've disposed of our PPE and equipment properly, we must do hand hygiene. Do appropriate documentation as is required or necessary, and then close the station by performing hand hygiene again.